I want to share with you a very simple way to deepen what happens in a therapy session. It is to take a pause. Yeah, it could be just as simple as this, a few seconds. And it could be, of course, longer. It could be a pause of 15, 20, 30 seconds, maybe more. So you might have some worries about that. For instance, you could say, my client is somebody who has a history of being abandoned. And so if I were to pause for more than a few seconds, they would feel dropped. Okay, very legitimate. So what we're talking about here is not applying a rote formula, but experimenting. And so you could think about all kinds of ways in which you could maintain a connection with the client while at the same time pausing. One of them would be simply to say, yeah, let's stay with this for a moment. And having framed it with the sense of, let's stay with it, you and I together, then there is that connection. I want to remind you that a pause does not mean breaking contact. While you're pausing, you are also paying attention to what's happening with the client, tracking them, tracking yourself, so that you have the possibility at any moment to change the course, to reconnect if needed. So this is not creating an obligation to mechanically perform a task called a pause, but to include it as part of the various ways in which you maintain and strengthen connection and attunement with your client. I'm going to be giving an experiential course on the DNA of change in therapy, and I'm inviting you to join me in this course. But whether or not you participate, I am inviting you to start today experimenting with the pause and learning from your experiments.